So this is the last step prior to undergoing surgery. It's the preoperative appointment. So you've already undergone the online pre-consultation course. You've learned that all about plastic surgery and how to treat your issue. You come in to see me for a face-to-face consultation. At that time, we go over very similar information, but we really point it directly to your individual issues, your individual concerns, and your individual body. After that, you meet with my patient coordinator. She gives you a price quote for the surgery, and at that point, if you decide to, you can look at scheduling the appointment for surgery. You can always wait too. Once again, there is no pressure for you to have surgery now. This is elective cosmetic surgery. You do it when you are ready, if ever, okay? Well, what if you are ready and you decide that you want to go ahead and proceed? Well, then take a peek at the previous video on your preoperative testing to know what you need prior to your preoperative appointment. And then you come in for the preoperative appointment, which is typically the last step prior to surgery. This is typically done about a week or two prior to the operation, and we go over a number of important things. So, once again, the preoperative appointment is anywhere from 1 to 3 weeks prior to surgery. You start the appointment by reviewing things with my medical assistant. She will go over the different consent forms with you, talk to you about the various risks of surgery, which we should have mainly already discussed together previously, as well as what the surgery may do for you. She'll also go over your pre- and post-operative instructions, simple things like how to take care of your dressings after surgery, the fact that you need to be off of anything but clear liquids prior to the operation for anesthesia. She'll also give you prescriptions for potentially for an antibiotic, for a pain pills, and any other types of medications that may be necessary after surgery. And she'll also take your before photographs. And by taking your before photographs, we'll have that in the chart so that we can use that to both plan your operation and to compare to your post-operative results. Now, after that, you will meet with myself. And with me, we will go over the preoperative testing and the clearance. So we'll go over your lab test, talk about any abnormal labs or any abnormal issues that may come up during your clearance process. We will review your medications. We'll tell you there's certain medications you may need to get off of. And you want to stop any aspirin or NSAIDs, okay, non-steroidal anti-inflammatories, about 2 weeks prior to your operation. If you're on any other types of concerning medications, we will talk about that as well. We'll discuss the surgery details, the risks, and the recovery once again. We probably won't go into it in quite the detail that we do in a face-to-face consultation because usually by now you pretty much get it. But we'll briefly go over what we're going to do and make sure that we're on the same page with it. And you'll also have time to answer or to ask any final questions of me, and I'll answer those questions to make sure that you feel very comfortable that you're ready to proceed to actual surgery. After you meet with me, then you will meet with my patient coordinator. She will review the scheduling with you, tell you where you need to be, approximately what time your operation will be, and when you need to be at the surgical center. She'll also discuss the social media consent form. So what we've been doing more and more in my practice, and it really has been helping, I think, educate patients, is taking small videos or photos of the surgery, both before, during, and afterwards, and putting it on social media, on our Facebook and our Instagram and other pages. Now, this is completely optional, okay? Don't let this scare you or startle you. If you decide that you really want to keep it private, you don't want anybody to know, you don't want anybody to see any of the surgery or any of that stuff, then by all means, not a problem, okay? We will not put up or share any of your information unless you have absolutely allowed us to do that. Okay, and so this is one of the things that my patient coordinator will review with you to see whether you might be interested. If you are interested, that's something that we do appreciate because I know patients get a lot of information out of it, and a lot of them will get a lot of comfort out of it as they see quote-unquote normal people undergoing procedures and doing very well afterwards. Okay, but once again, this is completely optional, and if you decide that you don't want us to share any of your surgery on social media, then by all means, you don't need to do that. And then there's some people that say, hey, you know what, you can share it, but let's just cover my eyes, or let's not show my face if we're doing a breast surgery. All of that we're definitely open for, and whatever you feel comfortable allowing us to show, we definitely appreciate it. And at the end, she will also arrange and make your final surgery payments, and she'll go over all of those dollars and cents type of issues with you. And if at any time prior to your surgery, whether it's after your consultation, your face-to-face consultation, before or after your preoperative appointment. If you have any questions or concerns at all, feel free to give us a call, okay? Once you're in that group, once you've had the face-to-face consultation and you're considering surgery, I want to make sure that you have all your questions answered, because surgery is a big, big decision. I know it is. I take surgery very, very seriously, and I take the fact that you may have chosen me to be your surgeon very seriously as well. It is something that I look at as a privilege and an honor to help serve you. Okay, so if anytime you have any questions regarding any of this stuff, feel free to give me a call. I am here to be your doctor first, your plastic surgeon second. So after the preoperative appointment, then comes the operation. Now, just to let you know, if you're considering breast lift or breast reduction surgery, occasionally we will have you come in the day before the actual operation for the markings. And that's typically only if you're having a breast lift or reduction. It gives you one last chance for us to go over those markings and make sure that we're very comfortable with everything. Otherwise, the preoperative appointment is where we kind of put all those loose ends together, go over everything to make sure that you are 100% ready, raring, and able to go for your plastic surgery. So thank you so much for watching. The next step after this would be the information that you need to get you set up for a face-to-face consultation at my office in Troy, Michigan. Thank you so much for going over the pre-consultation course. I hope it has been very useful for you.